We'll just give it another minute or so. All right, I'll go ahead and get us started. I know that people are still joining, and that's fine. And so just wanted to get us kicked off. So my name is Devin McGill. I'm the VP of Partnerships here at Genève, and I'm really excited to welcome you to our Mental Health and Menopause webinar. Today, we have joining us Dr. Yashika Dooley. She is a board-certified OBGYN, a female pelvic medicine and reconstructive surgeon, and she is one of Genève's OBGYNs who helps to support our patients. And today, what we're going to do is we're going to talk through mental health and menopause. That's what the whole point of this session is about. We're going to talk you through the physiological changes that happen in your body and how they can impact your mental health. But we'll also talk to you about the treatments that are available to you and how Genève can support you. So during this session, it'd be great if everyone just kind of stays on mute. And if you have questions, please drop them into the chat. I'll pull out some questions for Dr. Dooley to answer during the session, and then we'll leave enough time at the end to do Q&A as well. We are recording this session and we'll send it out afterwards, so no need to take notes. And if you want to, share it with anyone, you're welcome to send that out, but we will share this after the fact. So what we'll do is get started. First, I want to just ground us all in what menopause is. So if you haven't come to one of our sessions previously, what I want to just start us off with is what is menopause and how does it impact a woman in kind of the multiple stages. And so menopause, perimenopause really lasts 7 to 10 years, but really menopause is the second half of a woman's life. And so if we think about kind of all of the things you have to think about and how it changes your body, it's not just for a short period of time when you may be feeling symptoms, it's actually for the full second half of your life. And so the start of menopause is that perimenopause phase, and that can start, it starts on average around age 40, but it can start as early as 35, and it could be surgical menopause, so it could really start kind of at any age. But what we see in that perimenopausal stage that we get a lot of feedback on from patients is that's when people really start to see weight gain, that behavioral health impact of anxiety, depression, sleep issues, night sweats, incontinence. There's a lot of things happening in that perimenopausal phase as your hormones fluctuate. Once you have not had an ovulatory cycle for 12 months, we typically see that indicated of not having a period for 12 months. But if you don't have a uterus and you're not having a period, it's really about that ovulatory cycle. Once you haven't had that period for 12 months, then you are in menopause. In that menopause phase, it's actually technically just one day, that one day after you haven't had your period. But in that time frame, we start to see some changes in the symptoms around sexual pain, lack of libido, some vaginal issues, and particularly brain fog. And so once you've hit that, one day post your 12 months of no cycle, then you're in that postmenopause phase. And postmenopause really just lasts for the rest of your life after that. And we really start to think about what are the long-term implications of not having estrogen and progesterone progesterone in your body. And we think about that actually when we're treating you in perimenopause. So when we think about cardiovascular concerns, osteoporosis, and we really help to set you up for success in that perimenopause phase to prevent these issues in that postmenopausal phase. But we start to see, long-term concerns, health concerns like rising cholesterol, hair loss, particularly loneliness as well. And that average age is about 52. So I just wanted to ground us all in what are we talking about in terms of menopause? What does that look like? And what we're going to do and what we're all here to talk about, Dr. Yashika Dooley is going to talk us through how those physiological changes really impact us for our mental health. So Dr. Dooley, I'll turn it over to you.
Yes. So perimenopause is like we're talking about that 2 to 10 year transitional period before you go into menopause, right? So menopause is that once you've had no menstrual cycle for 12 months, and those months leading up to that menopause time is what we call that perimenopause. And so this is oftentimes when women are going to be having irregular periods, they're going to be erratic. You may have no cycle for a month or two, and then all of a sudden women will be having really heavy erratic bleeding. And every month there's this surge of estrogen that's going to occur in the first half of the cycle. And then there's a surge of progesterone that occurs in that second half. And the ovaries are still producing eggs, but more estrogen is now needed to actually stimulate those ovaries. And so throughout that cycle, those estrogen levels are getting higher, the progesterone levels are going to increase to match those estrogen levels. And you just get these really big spikes. And then you get these really big troughs in your hormone levels. And it's just this crazy roller coaster that's going on. I liken it very similar to when you are a teen, right? And you have those kind of huge fluctuations as well. It's all of those fluctuations, that roller coaster effect that's happening with those hormones that is causing the brain to be like, oh my goodness, what is going on, right? And that's why all of a sudden you're having these symptoms. Anxiety, you can have anger, you can have depression, you can have mood swings. Things that normally don't upset you or would not irritate you, all of a sudden really tend to push your buttons, right? And a lot of women will also have depression, especially if they've already had signs or symptoms of depression earlier in life. So if you've had depression in when you were pregnant or after you had your baby, or if you've had any diagnosis of anxiety or depression earlier in life, those women are going to be at increased risk to really feel the effects of the hormones and increased risk of having depression as you go into the perimenopause and postmenopausal periods. These symptoms are also going to be worse for women who have had any kind of premenstrual syndrome or PMS, or if you've ever had been diagnosed with premenstrual dysphoric disorder or PMDD. So the good news is that this is very common. It's not just you. And these mental health symptoms are temporary, right? And they can be temporized, both with therapy or with medication. But the thing that I always want to tell women is the mood swings, the anxiety, all of that is going to lessen. But in the moment, don't be surprised if you're feeling more of those symptoms. Next slide. So when we're talking about how menopause affects your mental health, again, it's normal to be feeling more emotional or having a harder time just controlling all of your emotions through this stage of life. Number one, a lot of women are going through just increased stresses, right? With relationships, maybe you have children, you're working, relationships with family and friends. I think all of those things start to shift. And then you add on the fact that your body just doesn't feel like your own. All of a sudden now, right, you're like, when I'm at work, when I'm trying to focus, I'm having brain fog. I can't be able to focus and do my work as effectively as I used to do. I'm not able to sleep. Maybe you are taking care of kids. Maybe you're taking care of parents. all of these things are going to impact how you show up and how you feel, in addition to the fact that oftentimes women just are not getting a lot of sleep to begin with. So you wake up, you're already cranky, you're already irritable. It doesn't take much to happen during the day to kind of set you off, and you're already kind of having all of those roller coaster of hormones. So the brain is so sensitive to these hormones, especially to the estrogen and progesterone. And so when you're having these dips and troughs, it's going to just make it very natural that any little change, anything else that's going on in your world can easily set you off. And so we just want you to know that when these things are happening, again, it's normal, but it's easy for you to be able to reach out and to get help. You do not have to suffer in silence. Next slide. So there are quite a bit of treatments for mental health problems in menopause. And so the symptoms, how they show up, how they affect you and impact your quality of life are going to be widely differing between women. And so, of course, then the treatments are going to differ as well. And how much it actually affects you is going to change. So there can be some women that have anxiety. They may have a little bit of depression. They may not be sleeping. And sometimes women are like, you know what? Now that I know that it's just my fluctuation in my hormones, now that I know that it's part of the perimenopause and menopause cycle, and I know it's not me, I know I'm not going crazy, they're okay with it. They're like, now that I'm aware, I can better deal with it, right? So sometimes just having that knowledge can be so powerful, and knowing that you can talk to other women or talk to your doctor can be very helpful, just to be able to express what is going on. And they may not necessarily need any kind of treatment at all, right? Just being able to talk about it, feeling validated and feeling heard can really just help you to be able to go through that period. I think as well, being able to let your family know and having them be able to understand and validate what is going on can be very helpful. When you compound all of these mood swings, all of the emotions that are going on, along with the hot flashes and the sleep problems, it's no wonder that oftentimes women really feel like they need something else, right? And so that's when we can start talking about, in the perimenopause period, maybe we're looking at low dose birth control, because one, you have the symptoms of anxiety, depression, and mood swings, but you're also still having menstrual cycles. And so because you're still releasing eggs, you still are at risk to get pregnant. And so this is why we tell women that that is something that we can consider, because it's going to help with the mood swings. It's going to give you a little bit more of estrogen. It's also going to help stabilize the menstrual cycle and the menstrual flow. And so all of that can just help to improve your quality of life. There's also good data that using antidepressants like SSRIs, Prozac, there are various medications can also help with anxiety and depression. And so those are some of the things that we also talk about when you book a call. We'll talk about what are the both hormonal and non-hormonal methods, what are the medications that you can use, but also what are the complementary treatments, right? So sometimes talking to a psychologist or talking to a therapist, if women already have a psychiatrist that's offering them medications, that's another way that we can partner to make sure that we're looking at your total self. We're looking at the whole woman and making sure that we meet you exactly where you are and providing exactly what you need so you feel your best and you can optimize your health and your life as you go through these stages. There you go.
Thanks, Shika. I had a question just in terms of, and it hasn't come up in the chat yet, but I'm sure that it will. If you guys do think about prescribing, a mix of an antidepressant or an SSRI, as women move into that postmenopausal stage and those hormones kind of really level out, can women start kind of taking themselves off of those types of medications, or do you recommend that they stay on there, or is it a case-by-case basis?
We definitely do it on a case-by-case basis, but I always tell women we are going to monitor your symptoms. And so if you are feeling like as you go through those phases, you're not as anxious, you're not having as many mood swings or depression, and you don't feel like you need medication any longer, we will, if we've prescribed the medication, work on a plan to wean you off of those medications. Or if you have had them prescribed by an outside psychiatrist or therapist or doctor, then we can work with those doctors and say, okay, what is a plan to get you off of those medications, but still ensuring that you feel your very best. So definitely, you are not required to be on them forever. It's like, how can we get you feeling good? And if that's without medications in the long term, I think that's a great idea.
Awesome. Great. So I'll move us along, and we definitely go ahead and start dropping the questions that you may have into the chat. I'll bring us forward to how Genève supports mental health in menopause. So our overall model is a fee-for-service model. We have coverage in all 50 states. All of your services run through insurance. We have coverage through Aetna, United Healthcare. We have a new one coming up that we will be announcing in the next week or so. And then also we have coverage through Progeny. If you have Progeny menopause, your employer offers that. So we do have all of our doctors or OBGYNs. They are specifically trained in menopause. So they aren't just OBGYNs that you kind of see at your brick and mortar who maybe delivered your baby. They could be. And typically OBGYNs gain that menopause experience and education as their patients age. But all of our doctors focus on menopause and are menopause certified. We also have registered dietitian, nutritionists who are cognitive behavioral trained. And so as Dr. Dooley was talking about, there are multiple ways to impact your mental health and menopause. Some of them are through specific medications, but there are other ways as well in terms of making changes to your lifestyle. So I work with our registered dietitians. I'm starting into that perimenopause phase where I am having some severe anxiety and really feel that kind of towards the end of my day. And so I work with our registered dietitians to think about ways to kind of mitigate that. And one of the things that my dietitian, her name's Katie, what she has recommended is to just go for a walk, right? So after I'm done with work, just go outside, get some fresh air before my kids get home, and just go for a walk. And it really allows me to just move my body, to get that stress out, to get that anxiety out. And it really does help to know that it's not me, I'm not going crazy. It's just part of what's happening in my body, because I typically do see that during the ovulatory phase of my cycle. And so it's really amazing to kind of be in tune and aware with my body about exactly what's happening. It helps me just feel a little bit better. So that's definitely what our team has really supported. And as Dr. Julie talked about as well, we have a partnership with psychologists and psychiatrists if that's needed. So for our initial visits, we do a PHQ-2, so it's a mental health screening, just to give us a sense of kind of where you are. And if we need to escalate to a PHQ-9, we will do that as well. And if it's indicated, we'll refer you to a psychologist or psychiatrist to help you get the support that you need. And then, of course, there's also in-person care that you may need, like if there's a regular bleeding after you've finished menopause, or if there are other types of in-person treatments that you need. We are part of the Unified Women's Healthcare Network, and we can make sure that you are referred to an OBGYN that is within your network. And so the last thing here, before we start to get into questions, we're getting all sorts of really great questions. And so thank you, keep those coming. I will walk Dr. Dooley through them. But as you think about how, I hope that this session is resonating with you and you'll get a lot more information from these Q&As. The Q&A part is always my favorite part. But if you are suffering from any of these kinds of behavioral or these mental health symptoms, and you're in one of these phases, or you're not sure if you're in one of these phases, and you just have questions or want to talk to a doctor and just talk to them about your symptoms and what you're experiencing, you can go to Genève.com, click on the Get Started to set up your free account. And then you can set up an appointment. And so I highly recommend you do that. We only have, it only takes 3 to 5 days to set up an appointment with one of our OBGYNs. And so definitely recommend you take care of yourself and take care of your mental health by booking a visit with one of our Genève clinicians. So what I'm going to do is I'll leave this up, but I will start to go through questions. So Dr. Dooley, after menopause, could you also experience symptoms of anxiety, depression? So once you've actually fully had that 12 months without an ovulatory cycle, are we still going to have these mental health impacts because of hormone changes, or is that going to be related to something else?
It can be related to both. And yes, you can still continue to experience anxiety, depression, whatever it is. I think you always have to remember, right? Some women are going to just be at increased risk, and maybe they've already had those symptoms before they even went into the perimenopausal period. But also, there are so many life stressors that occur later in life. And so sometimes it's just those things that are happening, right? It's what's going on in the world, what's happening with my family. I'm worried about my parents. I'm worried about my kids. I'm worried about my job. And when all of that is coming in, it's no wonder that women can be very anxious. They can still have depression. They can still have any number of mental health symptoms that still need to be addressed, even if you've already gone through the postmenopausal period. And some can be related to hormones, but some can just be related to life, and that's okay too.
That's great. This is a question we get almost every time, and so would love for you to address this. Do we take hormone levels? So do we do blood tests to check people's hormone levels? Why or why not?
So we do not check hormone levels. And the main reason is because treatment for perimenopause and postmenopause for most women is going to be quality of life, right? And so there is no blood level that's going to tell me how symptomatic you are, how much sleep you are not getting, how much brain fog you are not having. And so I'm always like, if you feel like your day is being impacted, if you feel like you can't think, you can't work, you can't function, you're more irritable than your normal baseline, that's the time where you could reach out and start getting treatment. And so even if I get blood levels that show that they are normal, I would still want to treat your symptoms. I'm not going to have you suffer just because a lab test is showing me one thing or another. In addition, when you're in perimenopause, like I said, the hormone levels are wildly fluctuating. And so you will get these really big peaks and then you'll get these really big troughs. And so depending on when you test from day to day and depending on what time of day, those numbers are going to be wildly varied. And so it's hard to use them as a reliable representation of what's going on in your body because things are constantly in motion. There's not one number that is going to signify anything.
Yeah, and I love that because really it speaks to how our clinicians listen, right? And listen to and believe you when you say you're experiencing something and how it's impacting your life. The blood test isn't always going to show that, but we sit and we listen and we really make sure to take care of you regardless of what a blood test shows. So that's amazing. Do you find that patients report that night sweats are worse during certain times in your cycle?
No, I feel like the quality of the night sweat really depends on how well a person is sleeping, how deep they sleep, and how much it affects their REM sleep. And so there is no time when I'd say, like, if you're earlier in your ovulatory cycle versus later, that people are going to be more affected. I think it really just depends on how well you sleep in general and how you're affected. Like, so I find that people who are very light sleepers and it doesn't take much to pull them out of their deep REM sleep will notice that they're more bothered by their hot flashes just in general because it doesn't take much to wake them up.
Makes sense. All right. So, let's see. Okay, can you stay on low dose birth control pill after 50 if currently on them to reduce some of these symptoms? I've heard conflicting things.
Yes, and this is one of those things that it just needs to be individualized. So we always know that once you're getting over 50, we're going to have more concerns and we're going to be screening, right? So we're going to say, okay, what does your blood pressure look like? Are there any other risk factors that we're concerned about, especially like if people smoke or if there are other things that are going on as far as high blood pressure, diabetes, anything like that, that might say, it's probably not best anymore for you to remain on the birth control pill if we can now switch you over to like the estradiol patch or something like that. There is no one static answer. I just think it's one of those things that we know around 50 is where we want to just kind of reevaluate, see what your symptoms are. Are you still having irregular menses? And what's going to make you feel your best? And if we can switch you to a low dose patch, that will be something that we would at least discuss and kind of talk about the risks and benefits for each woman, depending on what else is going on.
Right. What I continue to hear every time we have these conversations is every single person is different, has a different experience, and your team really focuses in on creating a specific plan for each specific patient, which is amazing. I love that.
Absolutely.
Can hot flashes and brain fog come back after you have been on estradiol and progesterone?
Yes, they definitely can. It depends on how much estrogen and progesterone that you're on, right? So in very early perimenopause, you might be on a low dose patch and it works really well for, say, a year. And then as your levels of estrogen and progesterone dip inside of your own body, we might then need to increase your patch to keep you at that same level. So it's not uncommon. And this is why we have you follow up, because as you continue to go through that perimenopause transition and going into menopause, your levels are going to continue to dip. And it's not uncommon that we might need to increase your doses if you start to show signs or having more symptoms of like hot flashes, night sweats, brain fog.
Great. What can I do for hip pain due to tendinitis secondary to menopause?
Um, in general, if you've had a workup and they've already ruled out that there is no kind of trauma, you don't have any kind of tear, they're not concerned that there is some other reason like arthritis or something, most women will do better once they get on some kind of hormone replacement therapy. So, like if they're able to get on some kind of estrogen, one, it's going to help level out your estrogen levels, but two, once you're starting to feel better, once you're not having pain, most women are able to be active. And now we can start to build the muscles and those bones and the joints and get you moving. And so the combination of those two is really what helps most women.
Great. All right. We're getting tons of great questions, so I'm going through them as best I can. What about hormone positive cancer? Any treatments available?
So for women that have had hormone positive cancer, and typically that's going to be estrogen positive, like breast cancer, those women, we're going to talk about non-hormonal therapies. So we'll be looking at, do you want to try like an SSRI? So there are quite a few that have long been used to help women with their hot flashes and their night sweats. And we know that they can provide symptom relief. But also new on the market now is Veoza. And so that's another thing that we will talk to you about. That requires some more blood testing, and we just need to make sure that you are a good candidate. But there are lots of other things that we can do if you're not a candidate specifically for estrogen. Also, sometimes we'll talk about biofeedback or behavioral therapies. So those are some other things just to help deal with the symptoms, especially for women that are like, you know what, I really rather not take any medications at all. I'd like to be as holistic and natural as possible. And so there are lots of places that we can start and look at. And this is the time when I really will pull in our registered dietitians and say, let's also look at their diet, right? What are the other things that we can maximize and optimize and see if we're getting them better sleep, if we're getting them feeling better in their body, if we can have them getting, more movement and exercise each day. Sometimes that can also just help you to feel better overall. And we can then delay, if you aren't interested in taking medications, having to do any of those things.
Great. And we have a question here about significant others and husbands and support. So I'll start, and then Dr. Julie would love to hear your take in terms of how you've seen that work. I would definitely say share this recording and any other Genev educational webinars with your partner and invite them to future ones. Education about menopause, the menopause transition, what women are experiencing and going through, that alone, kind of just making sure they understand exactly what you're experiencing, that will help just really make things a lot better. So that's the first thing I would recommend. I would also recommend, we have access to free educational resources. And so we have a ton of articles and education on our website that would be really helpful for them to that's a really great way for them to learn more as well. But Dr. Julie, what do you have you recommended?
I think just communication. I think we have to just remember that our spouses, our partners, our friends and family aren't going through what we're going through, right? And so it's hard for them to even comprehend that you're having these hot flashes, or all of a sudden you're irritable and nothing has really happened, or the fact that you're so exhausted, but it's the morning and you've been only up for 20 or 30 minutes, right? So I think when they realize what you're going through, when you can actually tell them, I'm really irritable because I didn't get a good night's sleep and I haven't slept for the past couple of weeks. And so, yes, I know it's morning and I just woke up, but I'm already tired, right? And so now I'm cranky. I haven't been getting sleep, or I've been up all night, and now something else happens, and it doesn't take much to just kind of throw me over the edge, right? And just kind of acknowledging, like, this is how I'm feeling. And I do feel like my hormones are all over the place. And I do feel like I'm going a little crazy. And sometimes, like, I just need to be validated, or I need people just to listen and understand, or try to understand. I think that can also be helpful, because you just have to remember that they're just watching everything from the outside. But when we're not talking, when we're not communicating, when we're not sharing with them all that we think and feel, it's hard for them to even meet us any place. It's hard for them to even begin to understand. But I think when you can start trying to find words and expressing, I'm just really hot all of a sudden, I need to go outside, or I need to, I just need to take a break, I'm irritated, or whatever it is. And even just saying, it's not necessarily you, it's me. It's the fact that I'm going through all of these hormonal swings. I don't feel like myself. Just allows people to not take it as personal, because it can really, I think, feel threatening or uncomfortable to everybody around you when they're like, who is this person? That's not my mom, or that's not my wife, or that's not the person that I married, right? And so you just letting them know that you are also aware that things aren't quite the same, but you are also trying to work through it, and getting help can be very validating for them.
Yeah, I love that. I think communication is super, super key in this stage for sure. Um, can you talk a little bit about ADHD and menopause?
So again, ADHD falls in line with all of kind of the other spectrum of brain disorders, mental health disorders. And I think for people that just have ADHD, right, it's already very hard for them to focus. It's hard for them to concentrate. It's hard for them to do any one task. And now you add on the symptoms of perimenopause or menopause, where women at baseline will say, I have brain fog and I can't pull my words together and I can't be able to focus. And I think it just compounds it, right? And it's hard to suss out exactly what's due to the ADHD and what's due to maybe my perimenopause or menopause. And again, this is where we're just like, let's just treat you. Let's just take great care of you. But it's not uncommon if you have any kind of mental health disorder, if you have any kind of problems cognitively where it's hard to think or focus, that going through perimenopause and menopause is just going to amplify what are your symptoms already at baseline.
Sounds fun. Are there any topical treatments that help for vaginal atrophy and preventing progression of that or improving it?
Definitely. There is estrogen cream that can be used. There are also estradiol pills that can go inside the vagina, and both of those can help to rejuvenate the tissues in that area. Oftentimes there's vaginal dryness, irritation. You can get increased urinary tract infections just with wiping or wearing underwear. People will say it's always just very irritated or burning. Maybe there's you may notice that the tissue is red. And that is just from lack of estrogen, and just being able to put estrogen on there can help. Also, I tell women having some kind of barrier. So it's almost like if people kind of like when babies used to get diaper rash, right? When the area gets irritated and now you're rubbing, or if there's like sweat and the moisture is not getting wicked away, it just compounds the problem. And so I think there are a variety of things that then we need to kind of talk about, especially for women, like if they have urinary incontinence and they're wearing poise pads, right? Or they're wearing something that might keep a little bit more moisture against their skin. It's now about how do we protect that skin, in addition to giving them some kind of estrogen to help heal and repair it.
So this is a question about the increased risk of stroke. So it said, if you're just replacing the estrogen the body produces, why does it increase the chances of stroke?
So we know that estrogen can be a procoagulant, so it can make the blood vessels or the red cells stickier. And so for some women, if you're at risk when you take estrogen, so this could even be like earlier on in age, maybe they were on a birth control pill, right? And so when all of those red cells get sticky, you can get a clot formed. And so that is just something that can happen. if women have been on estrogen in the past and they've never had any problems, they're at a significantly lower risk of going on hormone replacement therapy and having that happen, because the amount of estrogen that's in hormone replacement therapy is like 100 times less than any birth control pill or pregnancy that you might have had earlier on in life. But we always tell women nothing is absolute. And so we always just want to kind of talk about it. In addition, women often are more sedentary later in life, right? Especially after COVID, a lot of people are working from home or working in front of a computer. They're not moving as much, or maybe they are having other issues. So maybe they're having surgery. So there's lots of other compounding factors that could be going on. And so that's why we're always kind of talking to women. We want to talk about the risk, but we don't want to blow it out of proportion. We want to let you know there is a slight risk, but it's very slight. And for most women, if you don't have a history of blood clots or being told you couldn't have estrogen, you've never had a blood clot in the past, for most of those women, it's going to be completely safe, and we have no problem starting them on that medication.
Great. And we had someone ask about, they have a history of pulmonary embolisms and they would like to take estrogen when the time comes. Can they do the patch? It seems like it's kind of, that same, response.
Yeah, it's probably along that lines. Most, that's one of those things where we would have to kind of talk to you. But for most people, they have had some kind of medication or something that caused them to have a pulmonary embolism. And so most likely you would not be a candidate. Occasionally, though, people throw a clot because they've had surgery. So they weren't on any medication at all. They had no contraindications or no reason why they couldn't take estrogen. But because they were just immobilized, right? They had some kind of big surgery, typically like orthopedic surgery on like a big bone and on their joints, and they weren't moving at all. And they will throw a blood clot just because of surgery. In those cases, that's when we would kind of review with your doctor and kind of look over your medical records, see what the cause of the pulmonary embolus was, and then kind of talk to you about your risk if you would be an appropriate candidate to still try one of the low dose patches.
Great. Can you talk a little bit about why we do not prescribe hormones through compounding pharmacies?
So we just know that the compounding pharmacies are making everything to order, and it's being made by humans. And as we all know, humans make mistakes. And so it's always just a risk for us, one, to know what exactly is in that formulation that they're making, and has there been any risk that has been taken? Is there been any reason that we don't know exactly what it is? And we like to use the FDA approved medications because we know exactly, if we give you a prescription, we know exactly what is in it. We know that it is pure, and we have no concerns about any additional additives or anything like that that has been put into the medication. You just don't know that when you're using a compounding pharmacy. And again, because they're making it, it's kind of like making a cake. Even if you make it from the box, right? It's kind of like, yeah, this is pretty close to what it should be, but it's not going to be as precise. It's not going to be as exact. And you're always then introducing human error. And we just like to limit all the human error, especially when we're giving you medications.
Great. I love that. And this is going to be one of our last questions. So what do you think of dietary women's supplements such as black cohosh? So before you answer that, we do have a couple of articles about other types of supplements that we recommend to support menopause. I'm dropping them in the chat now, but also Dr. Julie would love for you to answer that question as well.
Yeah. So I think that there have not been a lot of long-term studies showing a certain benefit that every single woman is going to get. So I think it can be helpful. We definitely know that it's not harmful. And so it's one of those things that I tell women, you can definitely try it and you can see if you like it. If you find it beneficial, please continue it. This for me is very similar to if I have a headache, what's the best medication? Some people like Advil, some people like Tylenol, some people like Motrin, but every single person is not going to like the exact same thing. And it's because the way our bodies function is a little bit different. And so I think for a lot of the different supplements, it can be very similar. It also depends on what is your body needing. And every person doesn't need magnesium or protein or calcium or whatever in the same level if they're already getting it in their diet. And so that's one of the great places where our registered dietitians come in, because they really talk to you and go do a deep dive into what does your diet look like? What exactly are you eating? What are the things that you might be missing out on that you're not even aware of? And then let's talk about some of the different proteins and things that you might be missing, and then let's just target it. But for most women, you don't need to be just taking every single supplement just because oftentimes if you're really healthy and you have a very well balanced diet and you're eating all of the food groups, you might be getting a significant amount of that. And so it's really about tailoring it to what you need. And then also looking and seeing, when I take certain supplements or when I eat certain foods, do I feel better? Do I notice a difference? If so, I think that's great. But I don't necessarily want women to be spending money on lots of different things if they're not necessarily helping them.
Awesome. Love that. So before we close out, I am going to drop in a poll that I would love for you guys to answer. It just helps us to understand if we're really hitting the mark when it comes to these educational webinars. So the question is, I feel more knowledgeable about menopause after hearing today's talk. So would love for you to just submit your response there. And then I just want to thank you all for joining us. I really hope that this session has been educational and that you feel supported in your menopause journey. I really appreciate the time, Dr. Dooley. I know I feel like I have so much more knowledge about mental health and what I need to be thinking about in this perimenopause phase. So thank you so much for joining us. And I just want to let you all know we have recorded this session and we will be sending it to you via email tomorrow to the email that you registered with. And we do have every single month, we have additional webinars. And so you are now on our mailing list. We will send you a note to let you know what the next webinar is and when it is. And please join us every month. We love being able to share our knowledge with you. And you get to see a few different faces from our clinical team. And more importantly, I really hope that you understand what Genev can do for you in supporting you in your menopause journey. So if you haven't yet seen one of our doctors or our dietitians and you have questions, please set up an account. Please book an appointment. We are absolutely here to help you and we want to support you. There's no need for suffering. So we're here for you guys. So thank you guys so much. Really appreciate the time. Thank you, Dr. Dooley.
Absolutely. Thank you.
Thanks. Bye, everyone.
Bye.